Hi, I'm Dr. Irfan Khan. I'm the owner here at Polaris Dental Care. This is our team training video on taking impressions for night guards and for Invisalign treatment. Essentially, we're going to use this type of impression for anything that requires a very well-fitting tray. So most of the situations are going to be for night guard or Invisalign treatment, but it could be used for other things as well. So let me go ahead and get started, and I'll show you the instruments and all the supplies that we need for this treatment. Okay, so let's go through all of our supplies. To take our impression, we're essentially going to need some impression material and some trays. So on my tray here, I have medium, upper, and lower trays. I also have another size, in this situation, small upper and lower trays. We have our impression material. For this situation, we're also going to want to take a bite registration at the end, so I have bite registration material. We have heavy body or monophase material. And we have our light body material. Now let me use this as a time to explain the proper way to store impression material. This impression material has been used once before, and you can see it has a tip already on it that has material hardened. This is good because this hardened material on the tip will prevent air from getting into the cartridge and it'll prevent it from drying out. This partially used cartridge has a new tip on it. You should not store with the new tip on it. The reason is air can get through this tip and it can start to dry out each side of this cartridge. So after you're completed, wipe off the tip and leave the tip on there. We can see our VPS in this situation, this fast set monophase material, is a brand new cartridge. It has never been used before and it has a new tip on it. It has no tip on it. Before we use this material, we want to make sure that we bleed it, and I'll show you how to do that here in a second. The rest of our equipment, we have a couple of additional mixing tips, 2 yellow and 2 blue. We have some gauze. We'll have our actual impression gun, a timer, 2 pieces of 6x6 saran wrap, and I'll show you why we're going to use that. And that's essentially it. So it's pretty straightforward. There's not a lot of materials that we need to use here. Let me show you the proper way to bleed one of these cartridges. Okay, let me show you the proper way to bleed a cartridge. This is a new VPS cartridge. We're going to take the tip off of there, and we can see that this cartridge has a purple side and an orange side. We're going to load this cartridge into our gun, and before we add a tip, we're going to bleed a little bit onto a piece of gauze. The reason we want to do that is so we can ensure that the material is coming out of both sides of this cartridge consistently. If we try to use material where it's not bled properly, the very first little bit of material you get won't be mixed properly and it's not going to set the way it needs to set. So it's very important to go ahead and bleed it a little bit. And you can see right now the brown or orange is coming out before the purple, and now that purple comes out. So that is properly bled. If we didn't do that, the first chunk of material would have just been that reddish, orange, brown material, and that material would not have set, so we would have had a distorted impression. Now that we've bled it, it's ready to go. We can then simply go ahead and add our mixing tip. This cartridge is ready. The procedure we're going to go through is going to be to take one of our trays, and we're going to load it with this VPS material. After we load it with the VPS material, we're going to add this saran wrap right on top of it. Why do we add that saran wrap? Because we're going to do a 2-layer impression. First, we're going to have the purple monophase heavy body material, and then we're going to do a second layer with our orange. This saran wrap serves 2 purposes. One, it keeps saliva from getting onto this material that we're going to place in here, and by preventing the saliva from touching it, when we do our second layer, the 2 layers of the orange and the purple, they're going to adhere and they're going to stick together the way they're supposed to. Also, this saran wrap, when placed in the patient's mouth, is going to prevent this material from really getting stuck in between the patient's teeth. We don't want this purple material to get really intricate details on the patient's teeth. We really just wanted to create a trough or an outline of those teeth, and then the orange second layer will get the actual details. It's not good to have a lot of detail with that first impression with the purple, because You won't be able to seat that second layer back down correctly if you have too good detail on that first layer, so that plastic prevents that from happening. After we do that purple layer, we will add some orange into that exact same tray, and we're going to reseat it back into the patient's mouth again. After about 2 minutes, we'll take it out, and we'll be done. Okay, now we're going to do a live patient demonstration showing how to take one of these impressions on an actual patient. I've already pre-sized everything ahead of time, so I already know that a small tray is what I'm going to be using. Then open up for me. We're going to place the tray in the patient's mouth and check the fitment. We want to make sure that we're not touching on the sides of those back molars and that it's a nice comfortable fit. Does that feel okay? Mm-hmm. Good. We have a new cartridge here, so we're going to go ahead and bleed just like we showed. Now we're going to go ahead and load our tray. And we'll place our saran wrap, covering that just like that. We'll go ahead and place this impression in the patient's mouth. Is that okay? Mm-hmm. Now put a good amount of pressure in there and make sure you wiggle it a little bit to make sure it's seated fully, okay? That's still doing okay? Mm-hmm. Good. We're going to leave this in here for about 30 seconds. That's about all it takes to get the material firm enough to where it doesn't run once we take it out of the mouth. 30 seconds is not enough time to fully set this material. The reason we're only doing 30 seconds is because it'll continue to set outside the patient's mouth. And again, this is just our first layer, so it's kind of like making a custom tray right now. All right, we'll remove that. We can see what that impression looks like. And we'll go ahead and load for the bottom. We'll go ahead and place our saran wrap on the bottom as well. And we'll place this back in the patient's mouth. And again, I'm going to put some pressure. You doing okay? Mm-hmm. Make sure the patient's lip comes all the way around that tray. And again, we'll just keep this in place for about 30 seconds. As I'm taking this impression, I'm looking at the handle from behind the patient's head or above the patient's head and making sure that handle is lined up with the patient's nose. That way I know that the tray is seated directly in the patient's mouth. And just about 30 seconds for this as well. And then we'll take that out. Now we can see we have a good mold of the patient's lower arch. At this point, the upper arch is set enough to where we can remove the saran wrap without distortion. What we end up with is a trough simulating the patient's teeth, and this is nice and dry, so the new material will stick right to it. When we load this material, we'll go ahead and place it so we fill just the teeth. You don't want too much material here or this is going to run down the patient's throat. If you got a good mold with the purple, you don't need a lot of orange. And that's about it right there. Make sure you have suction ready in this part. You want to hold that. And we're going to go ahead and reseat that directly in the patient's mouth, and that orange, you can see, starts to seep up right at the top. You doing okay? Mm-hmm. We're going to check to make sure nothing's running down the patient's throat. Still doing okay? Mm-hmm. Now for this part, we do have to leave it for the full 2 minutes. So we can't take this one out early. We have to let this material fully set. So on a full 2 minutes. Afterwards, we'll take this out, and at that point, the lower arch will be fully set as well. So we'll be able to load up the orange in the lower arch and take our lower impression as well. Then we'll take our bite registration, then we'll be done. Okay, now that 2 minutes has elapsed, I'm going to go ahead and remove this tray. Now remember, this is a very, very accurate impression of this patient's mouth, so this tray is going to be stuck on there. If I don't touch it, it's not moving anywhere. As you take it out, you want to be careful not to hit the tray against the patient's lower teeth. So keep your fingers underneath it as you remove that tray so you don't end up hitting their teeth, okay? All right, you're going to feel a lot of suction, okay? There we go. And here you can see we have a perfect mold of the patient's upper arch. What we'll then do is go ahead and repeat the same procedure with the lower, where we're going to load that bottom tray and insert into the patient's arch. Take the bottom impression, then we'll take a bite registration, and we'll be done. Let me show you how to load this bottom one. Now we're going to go ahead and place the lower arch impression. We're going to press down fully and hold it in place. It's important that you hold this yourself. Don't have the patient hold it down. Don't have the patient bite down. You need to hold this yourself for 2 full minutes. Okay, 2 minutes has gone by, so now we're going to go ahead and remove our lower impression, okay? Just like the upper, remember there's going to be a lot of suction here, so you want to make sure you don't hit the tray against the patient's upper teeth. So you want to protect that with our thumbs, and we'll go ahead and remove this. And here we can see the lower impression. The final step is going to be take our bite registration, so we know how the patient's teeth lock together. Place a new mixing tip on here. Now with the bite registration, before we place it, we want to make sure we can see how the patient's teeth come together. Go ahead and bite down for me. And you want to get a visual reference so you know that the patient's biting down in the exact same spot. Go ahead and open for me. I'm going to place a little bead all the way across. See if we can adjust that camera. And bite. And we're going to check to make sure that the patient's teeth are all the way down. Perfect. I'm going to tell the patient to hold that for 1 minute. Okay, go ahead and open. Now we'll remove our bite registration. And here we can see a good bite registration. You know it's good because we can see that there are some holes in this where you can see that the patient's teeth had actually bitten right through the material the way they're supposed to. Essentially that's it. It takes about 10 minutes max to do that. Here doing the demonstration took about 11 or so. Really you can get this done in about 7 minutes. You have a total of about 4 minutes for the orange body to set, about 1 minute for the bite registration to set, and really we're keeping the purple in the patient's mouth for about 30 seconds each. So that's 6 minutes of setting time, plus about 3 or 4 minutes of material handling time, and really you should be done in about 10 minutes. Thank you. Thank you, Ashley.